Ma'am, we are live now.
Okay, should I start the video also?
Sure, ma'am. Sure.
Okay. So, good evening, everybody. I think I'm audible.
Yes, ma'am. You are clearly audible.
Okay, should I start then?
Yes, ma'am. You were saying something.
No, I was just asking, should I start as this session
Sure, ma'am.
basically?
Sure. We can start, ma'am. Good evening, my dear students. Welcome to one more session of CareerX, episode number 16. That is Career in Allied Medical and Paramedical Sciences. It's one of the most lucrative and hidden career throughout. If we go for our India as a culture, we go for medical and engineering, but yes, we always forget about allied medical and paramedical. We neglect it, and most of we don't know about what is exactly allied medical and paramedical. But it is one of the career which has got an immense personality and respect in the future and in your life, in your lifestyle, and you live a lavish lifestyle roaming around the countries. So today we have with us Dr. Parul Thakral. She is expert, and she's the expert, and she has done her PhD in radiochemistry and clinical nuclear medicine from All India Institute of Medical Sciences, New Delhi, which is one of the premier institute of Asia. And she has also received the MSc and BSc degree in nuclear medicine and technology and radiography from AIMS New Delhi. Wow, ma'am. So AIMS is one of the fascination for the students, and we have the AIMS alumni here today with us. And right now she is working as a clinical research officer in the Department of Nuclear Medicine, FMRI, since May 2016. And before this, she was working with the Senior Research Fellow under DST. I think, madam, it is Department of Science and Technology, if I'm not wrong.
Yes, this is Department of Science and Technology. I was working in a project which was sponsored by Department of Science and Technology, and it was being done, or the work was being done in the Department of Nuclear Medicine of AIMS New Delhi.
Okay. And apart from this, there are a lot of things which I think the technical terms, it was very difficult for me to understand. TRO, DAT, and DOTA knock. There are a lot of terms. You will explain, ma'am. This it will be better. I'll not the right answer.
These are very. I think only the nuclear medicine personnel can understand these things.
Absolutely.
Basically, the names of our radiopharmaceuticals, which we are being using it for different types of scans, which we do under nuclear medicine. So, first of all, a very good evening to everybody. And thanks, Mr. Dalvinder, for such an exhaustive introduction. Anyways, I am Dr. Parul Thakral, and as he has already told, that I had my BSc and MSc and then PhD from AIMS Nuclear Medicine, or AIMS New Delhi. So, first of all, I have been told to talk about the allied and the paramedical sciences today. So first thing which comes in our mind, because I myself have undergone this thing that at the level of 10+2, we don't know about such things. We only know about MBBS. If you want to pursue a career in medical field, we only know about MBBS. So this is not the end of the game, and it's not only the MBBS in the medical field. Obviously, you would have seen whenever we talk about the medical science or the hospitals or everything, it's a large infrastructure, and there are many people at many stages which are working towards the final output. So obviously, the recognition which a doctor gets is obviously, I will not deny this fact that it is the utmost, but the paramedics, the allied health sciences, they cannot be ignored at all. So, what I think is that obviously, if you want to pursue your career in medical field, MBBS, to crack an MBBS exam should be one's most sought of thing. But everything does not end at that thing. And if you don't want to, or if you could not, so don't lose heart. And there are many other things which you can just think of and you can pursue your career in. So first of all, if we talk about allied medical sciences, people don't know about what it is. It is basically the broad range of disciplines that produce health professionals who are not the doctors. You can call them as the supportive thing, or supportive staff, or the things which are not done by the doctors, but by these allied medical health professionals and the paramedics. So you may ask whatever questions or whatever queries
Sure,
you
ma'am.
have.
Sure, ma'am. A very hefty clarification you have given, a Herculean clarification about the career you gave it. But as a counselor, ma'am, I will ask you the first question, going a bit out of the topic and a bit out of the script. Being a counselor, whenever I talk about a paramedical and allied medical for the students as a backup option for the medical aspirants, so there is a concept that they have in the mind that इसमें नर्सी बन जाओगे आप ज्यादा से ज्यादा जाके इंजेक्शन लगा पाओगे, so that the thing they come into the mind. So वो अच्छा फील्ड नहीं होता है, that is not a secure field for girls. So I think you're the best option who can you're the best person who can address this question and this myth that parents have in their mind. So always, yeah, here you are there with ma'am, duty with the brains. What exactly when I talk about this sentence, so how girls are empowered in this career?
No, it's not that कि सिर्फ nurse बन जाओगे और ऐसा होगा. Actually, today the allied health sciences disciplines are quite. It has a broad spectrum. So it may include like dental hygienists, diagnostic medical sonographers. Like ultrasonography today can be done not only by the doctors but the ultrasonographers. Then you have dietetics, and today like everybody is very diet conscious. Nutritionists and dietitians, they have a lot of scope. Then you have medical technologists, like the people who do the, like, you would have heard of CT scan, MRI scans, and the X-ray scans, and different types of radiological imaging. So it's not only done by the doctor, so it's being done by the professionals, like these are called as medical technologists. Then they are occupational therapists. Then one more very important field is the physiotherapy. Today, this world is like every second a person needs a physiotherapy for himself or her, for any other people in their family. So physiotherapy is again a very good branch. Then you have respiratory therapy, speech therapist, optometrist. So it's not like कि हाँ एक ही जगह पे जाके आप you'll just have a standstill. Obviously, if you choose a good career and you just pursue your things, you can always have a good better outcome and you can stand at a better place. Like for me, if I say I started with BSc radiography, so at the end of that, and after doing a job for 2-3 years, I found that it was a standstill. What should I do again now? Then I pursued with my MSc nuclear medicine technology. It was again a technology, but it gave me a different field. Nuclear medicine is basically where we use the radioactive material. Radioactive like isotopes are used, and they are tagged with different pharmaceuticals to do different types of scans as well as the therapies. And these therapies are very important and useful in the field of oncology. Like we know that cancer is like breeding like anything. So here the nuclear medicine therapies have a big role. So when I did my MSc nuclear medicine, I got a new, when obviously you will have to pursue yourself. If you just make yourself stagnant, then you are obviously stuck at one place. But if you try to find out some ways, then you can always find some good things. Because एक बार चलते रहोगे, ढूंढते रहोगे, सोचते रहोगे, obviously you will have to find out and you will have to pursue yourself. ऐसे नहीं है, बहुत clear paths नहीं है. So you will have to find out. So when I pursue my MSc nuclear medicine technology, then I thought, okay, now I can do my PhD. So when I did my PhD in the radio labeling of drugs for the cancer patients, now I have immense scope for myself. Like I'm involved, I'm among few people in India who is doing this type of work, like which includes the radio labeling of drugs for the cancer therapies. So obviously it took me a long time, it took long years, and I had to pave my way out of it and had to think what to do. Then obviously, if you think that MBBS is the end, that is also not the end. After MBBS, you will have to do your what you would say, MD in some subject, PG, which is known as PG in some subject, and then you do your SRship, and then again you go for DM or MCH. The medical field has no end. So the main thing is that you have to you have to have that passion and you have to pursue things.
Okay.
So if you don't want to get through MBBS, you don't want to spend so much of time, and you want to have some different field where you can excel, then this is a good there are many streams out of it. So there are, like, you can opt for microbiology, OT technicians, then there are cardiac care technicians, and then MLT, which is the medical lab technology. So if you have the logistics, like if you suppose if everything favors you, you can get through. You can, if you take physiotherapy, then you can set up your own physiotherapy lab, and you can just it's like anything. If you are a specialist in MLT, you can again set up your lab, and then you can become an entrepreneur. So it's up to you how much can you take out of it.
Okay. So beautifully you answered the question. I think this question needs attention because a lot of misconceptions and myths are persisting in parents. So, ma'am, again, I'll be asking one of the question out of the scope. It's a 10 to 15 years of journey of your academics around to learn and to have the research. And today you are in a place where few of the people are only into this kind of research in the radiation and nuclear medicine. So, ma'am, how many countries you have explored yet?
Just for vacation or for work?
For work, I'm just asking for the work.
Actually, for my PhD work, I had been to several places in India, as well as I've been to Amsterdam in the university BUMC. It's in Amsterdam, where I spent some time and learned about this radio labeling of things. So finally, and I had been to Bad Berka in Germany, where again this type of work, because Europe is a little more progressive in terms of all these types of therapies and all. So science is a little more progressed as compared to India. Obviously, US is quite back, but Europe has a good scope. And so I've been there to 2 countries for my PhD work, and then learning about these and I had attended plenty of conferences in India as well as abroad. So presenting my papers and my work there on oral as well as the poster presentation, doing oral as well as the poster presentations.
So, my dear students, a big information once again. So it's not only the doctors who roam around the different countries, it's also the paramedical and the light medical professionals also go to the other countries. So आप यहाँ पे देखिए बच्चों, यहाँ पे समझने की कोशिश कीजिए कि ये जो करियर है, ये आप जिस करियर से प्यार करते हैं वो आपको दूर तक लेके जाता है. अगर आपको करियर से प्यार नहीं है, आप आधे मन से उस करियर को कर रहे हो, तो आधे तक ही जाके आपका साथ छोड़ देगा. So every career is some or the other. It has no end, and it has some kind of grace involved in that, and you have to understand it and you have to love it. And students, the chat box is open for you. If you have any question for Dr. Parul, she'll be addressing the question. So keep posting your questions. So, ma'am, when we talk about paramedical and allied medical, what is the difference between para and allied?
Actually, paramedical is basically for emergency procedures. Suppose you have meet an accident and you call an emergency team there, then the cardiac care which is given by the people, they are known as paramedics. But in India, I have seen that this allied and paramedic, the paramedic terms are used interchangeably. Matlab, anybody in even in AIMS, if you go for that course, you call it as paramedical course. Nobody calls it as allied course, because in AIMS it has three courses, like for optometry, radio diagnostic imaging, and the occupational therapy. So nobody calls them allied sciences. It is mostly called as paramedics. But if you go in terms or as the meaning, the paramedics is usually used for the emergency response team.
That's great. So, ma'am, what are the skill sets required for the professionals in this field if a student is looking to pursue this career?
Basically, the skill set, he has to have his 10+2 in science, with physics, chemistry, and mathematics sometimes for some courses, and obviously biology. And then obviously the all same things, he should have the communication skills and then ability to be a team player, because paramedics or the allied health professionals can't work alone. Obviously, if you see the working of an hospital, it's a teamwork. So you should know how to work as a team player. Then you should be doing multitasking. And obviously, you should have empathy and compassion towards the patients and the work you are doing. And that's it. Basically, you'll have to crack the examinations, the entrance examination, then only you can get through a course.
So, ma'am, as you have talked about the entrance examination, so if you can name any 2 to 3 and national level entrance examinations which students can target.
Actually, there are many courses like a BSc in BSc in dental imaging, BSc in radiological imaging, BSc in nutrition and dietetics. Then there is perfusion imaging. Then BSc in speech therapy. And again, the BSc for ultrasonography, then dental hygienist. So you will have to just find out which subject do you want to pursue and where can you find these courses being done. Mostly BScs are done, but at some places diplomas are also done. Like for diploma in MLT, that is medical lab technicians who do the blood test and all. So first of all, you need to find out what interest, in which branch do you have your interest and you think that you want to pursue in that, and then you can find out where this course is being conducted.
Okay. Like AIMS has its own examination. Likewise, ma'am, ZIPMER and Fortis Memorial.
Fortis Memorial, I don't think it has its own BSc and MSc courses, but AIMS, PGI, RML Lucknow, and then there is SGPGI Lucknow, JIPMA, and in a private institute, you can call that this SGT University in Gurgaon, then Manipal in Mangalore. So these are all the institutes which are conducting different types of allied health science.
So there is national level, only 1 or 2 are there. That is PGI Chandigarh, AIMS, and ZIPMER. And probably rest all are their college specific and university specific and private.
Yes. Even for AIMS and PGI, I think you have to fill up the form individually.
Okay. So it is completely university and brand specific. It is not again there is not a combined exam.
Combined like NEET and all. It's not for the allied sciences.
But when we are talking about these myths we have talked about, that there is no respect in this job. This is the also point come out. So you have already spoken it about, but how would you address this to the parents if they watch this video? So what kind of respect we have in paramedical and allied medical?
Actually, I can't deny this fact that if you talk of the medical field, a doctor has the utmost respect and importance, obviously, because suppose you go to an gastroenterologist, you go by the name. Okay, he is so and so doctor. He has a good name. It's his individual respect. So I will not say that a paramedic is as important or as respectful as a doctor. But if you just pursue your field and find out ways and make your career respectful, then you can, if you work towards this, you will find ways how to make it respectful. अगर आपने एक MLT जो कोर्स कर लिया और आप बस एक टेक्नीशियन बन के रह गए, तो it's obviously difficult. But if you pursue it, suppose you open your own lab, you become an entrepreneur, then you have your own respect. Now you are an entrepreneur who is running a lab, and you have multiple people working under you. So it's up to you and your logistics and everything. How do you pursue your course?
Yes. Adding on to your point, ma'am, as you said that about only MLT technician, but yes, if we'll go for a reality fact about being into the MBBS program also, if just doing a MBBS and PG is also not enough today.
Not enough these days.
We want to become a good doctor. Yes, super specialization is required.
Very much required these days. Right. If you end up doing only MBBS, first of all, to get into MBBS is a very, very difficult job these days. The pass percentages are very less. And then once you pass through MBBS, you spend 5 years of rigorous hard work and everything. And once you are out of MBBS, you are again on road. Then again, you will have to think, you will have to prepare for your PG entrance exam. And then you need a specialization. First the specialization and then the super specialization. Again, after MD, you need to have, sometimes you need to have DM or MCH courses or MS courses. So don't think that the life of a medico is easy. So it is the same way. If you get through MBBS, there is so much of it, so much of hard work, so much of time taking procedure. So again, as he has to thrive, you will also have to thrive. So that's the thing. And once you are,
yes,
you don't get through a PG entrance, you are again on road. Not now what to do. Now you are an MBBS with just an MBBS degree, so you are nowhere.
Absolutely, ma'am. I agree with you. So anywhere, my dear students, mehnat aapko karni padegi. Hard work and smart work both are required together to survive in today's world. So, ma'am, I said absolutely right. It's not being into the field of medico, not that it's stop. There is no full stop. It's always comma, inverted comma.
Find ways. As I told you about my journey, I did my BSc, then I did my job for 2-3 years. Then I did my MSc, then again I did my job for 2-3 years. And then I did my PhD. And finally I went to the job. So it was a long, long way and doing all things. Every time I have to think again, now what to do just to keep yourself going. If actually I was in a government job in AIMS, in the radiology department. So everybody was after me. You being a girl, why are you quitting a government job and that's and this and that and everything? Like, the Indian society. But I was like, if I didn't take risk at this moment, I will be stuck for my life in this job only. So I will not be able to do anything. And thankfully, my parents, my everybody, and were very supportive. I quit my job. I did my MSc. And then I did my job. And finally, when I got married, my husband pushed me, leave your job and do your PhD. So I had been a little, I should say, very lucky in that way. But I think if you want to just pursue yourself, you will have to find ways. You'll have to be a little progressive and keep thinking and doing something.
So, ma'am, if you talk about the career scope of an paramedic, so I'll not talk about allied medical now. I'll go with the paramedics term only. I'm learning from you today that it is paramedic, so I'll speak only paramedics today. So, if we talk about the career scope of a paramedics, what is the end? As you said that there is no end. So what exactly the procedure is after BSc, what they can have, after MSc, what is the scope, and after PhD, what is the scope?
That actually this depends on what branch you opt for. So it is different for different branches. If you want a preliminary job, you will get after BSc. One thing for paramedic is you will never be without job. Somewhere or the other you will find a job, because every lab, every hospital, every thing which requires this type of departments will need people. So, as I told you about physiotherapy, suppose you did your BSc in physiotherapy and you got a job. Okay, it will start at around 20-25,000 per month, and then you can just gain experience. And then if you do MSc, then again I think that will be you can get the post of a higher the status. And I don't think in physiotherapy there's PhD. So it depends on what branch are you opting for. Like for dietetics, it's BSc, and MSc is the highest degree in dietetics. And then again, these days dietetics and nutrition is very sort of branch. You must be knowing the names of the dietitians which are gaining fame and everything. So it's up to you, how do you make yourself more prominent and important. So that is the thing.
Absolutely, ma'am. Absolutely. The dietitians who are available in metro cities like Mumbai, Chennai, New Delhi, and Bangalore, then other big cities or urban cities we have in the market. I have heard about one of my friend. He's a consultant, and recently he consulted for the dietitian Kareena Kapoor and Saif Ali Khan. He consulted and he charged 1 lakh per consultancy.
That is what I'm trying to say. That it's not like if you are, it's not that you would be having a PhD degree, then only you can have this sort of profession, your career. It depends on you. How do you project yourself? How do you take yourself? And once you enter into a field, you come to know about that field and how to dwell in that field. So that is the thing.
Now, ma'am, when we talk about this career, any career, the first and last question where the motive of the parent and student is exactly the salary. पैसा कितना मिलता है इसमें, कितना कमा सकते हैं. So what is the starting salary and the range, if you can share the range?
I think the basically for this, the preliminary is salary which you can draw it depends on what institute are you joining. Obviously, if you join a corporate hospital, you will be having a good salary. But if you join some diagnostic lab at a small place, that will have obviously less salary. So I think but basically it can start from 20 to 25,000 per month, depending upon what branch you choose. And it can just go up to, when you gain experience and everything, about 70 to 80,000 per month.
Okay. So it can happen, ma'am, from 25,000 to 70 to 80,000. Is it possible in the 5 years of span?
Not 5 years, I should say at least 10 years it will take.
It will take 10 years. Okay. So the career graph, it depends upon the kind of experience, the kind of institute, and the kind of sector I'm working into. So my dear students, it matters a lot, as ma'am said that. Choose your institute wisely and choose the sector which you're going to work in wisely. So that is going to give you a mileage in your career. It's not about getting anything, will give you a good, proper milestone in your career. Thank you, ma'am. You are going with the answers very beautifully, and I think the students must not have any doubt in the career, the way you are answering the questions. As ma'am, you said that there are domains and specialization, and with my personal research, I have gone that there are around, if I'll go for a PGI Chandigarh, which has the highest number of courses available, 67 kind of paramedics courses they have. But what are the currently trending and has a good future scope? If you can suggest 5 to 6 specializations which are going to be a good milestone for the students for next 20-30 years.
I think the most sought ones are the nutrition and dietetics, then physiotherapy, and then ultrasonography. Then is the medical imaging technology and nuclear medicine technology. Then optometry again becomes a good field if you open your own this unit for this lenses and everything for checking the eyesights, and then you can venture into that. So these are even the perfusion imaging is a good branch. And then comes the respiratory therapy. With these days where the COVID is being so prominent, respiratory therapy is also a good branch. So these are all trending ones. Dental hygienes, you must have noticed, it's not only the dentist who is working there, it's he's always supported by a dental hygienist with him. So again, this is also a good branch.
So, students, I think you have recorded each and everything. If you have missed out anything, you can go to the YouTube live CareerX channel. You can subscribe the channel and you can go with the videos. So the crowd which is watching in the YouTube live and the crowd which is there in the Zoom. So beautiful, ma'am. So these have a good scope for next 20 to 30 years. There is nothing going to hamper the scope of these careers. Beautiful. So, ma'am, when we talk about
One branch more, the radiotherapy technicians. They are also, there is a BSc in radiotherapy. It's again a oncology branch. So it's BSc and then MSc in radiotherapy. And if you have BSc in physics, then you can become a medical physicist in the branch of radiotherapy. And that medical physicist is a quite high paying job. But for that you need a BSc in physics. Then only you can enter for the medical physicist in radiotherapy.
okay.
So they are very high paying these days, because radiotherapy needs planning and everything. I think the term can be understood like it's like radiation therapy being given by machines for the cancer patients. So but one thing for that is you need medical BSc in medical physics,
So, ma'am,
medical physics or physics.
yes, exactly. So, ma'am, as you are already a PhD aspirant and you have gone through that phase, so how is the career scope? We have discussed till MSc, till PG. Now, how is the career scope of a candidate with a PhD degree?
Obviously, PhD, the little irony of our educational system and our medical system is that the non-medicos with PhD, like I'm Dr. Parul, but I'm a non-medical. So non-medico posts in government sector is a difficult thing. Okay, they will create posts for doctors, like you need obviously you cannot change the mindset that a doctor has a different position in medical field. So even for, if you go for the, like in AIMS I've seen, they will create assistant professor faculty post for medical person, but for a non-medico, that one post or two posts to be created, it's a very big job. So with PhD, once you have a PhD, you need a faculty job. You want that I should be a consultant or something. So again, but PhD, the thing with PhD is that it is not, this course is not available for all the branches. It's up for many of the branches, the upper degree is MSc only. So it's only in few branches that you can pursue your PhD, and then you will have to find a scope where you can get those consultant course and everything. If not in government sector, then in a private sector. Obviously private sector, once you get into research and everything, then you can be opted by the industries and everything. Again, it depends upon the branch which you choose.
So it's not every branch has PhD.
Yes. Not every branch has PhD. Like MLT, if you go for MLT, I don't think there is PhD in MLT. Like physiotherapy, there is no PhD in physiotherapy. So it depends on what branch are you choosing and where you can have your PhD.
So the branches which have PhD in them in future, if we want to get into the academics to be a professor, so that is also required. As you are also being a teacher, you have also been a
Actually,
professor.
then
Yeah.
I think PhD, then once you get a PhD and then in that branch, then you can have a teaching post. Like you can teach the students pursuing those branches. Then you can teach your BSc and MSc students. And that is the most sort of what career plan you can get.
Do academic score matter, ma'am? If you want to be a professor or a teacher, like we have to be 90 percentile throughout the career or 80
No, I
percent.
don't think once you have a degree, you have a PhD degree. Like, but in some courses, like in microbiology, if you don't do a PhD at MSc level, also you can get into a professor post.
Okay.
So it is variable for different branch. So you'll have to find out what branch you want to pursue, and then you have to work according to it.
Ma'am, when we talk about MBBS and being a doctor, so always there is a fascinating picture and illuminating picture of foreign abroad countries moving to the different country. But what exactly the scope for allied medical or paramedic students is for Indian students in abroad countries, and which countries would be the best?
For allied, actually, if you are into imaging technology, I know more about imaging technology, like for radiology and this nuclear medicine and thing. So you have a very good scope in US and UK. UK these days are it's taking people like anything. They don't have a workforce, so they take up people from here, and our degrees are very much recognized there. You just have to clear one or two examinations which they conduct, and that's it. And UK and US have a good scope, but if you want to go into the field of research and everything, then Europe is good.
In Europe, like Germany, it would be.
Germany and like this Holland and these countries are good for research purposes. For
So,
further studies and all, if you want to get a job or something, then US, UK is good. But if you want to get into research and learn, have follow fellowships or something, then Europe is good.
so, ma'am, as I talked about that, a lot of students from India right now are preferring for abroad. So, if they have done their graduation or post graduation from abroad, so do they have a good career scope in India, or there is some kind of gap?
I'm not very sure about it, but as much as I know that the degrees out there are not recognized in India.
Okay.
So you'll have to pursue something here,
Okay.
and then only you can take it.
So big information, my dear students. So if you are looking for abroad, so probably it has not been recognized.
Better you do your course here and then go abroad.
Okay,
So
is
you
it
have
better
a good opportunity. Job opportunities are good in abroad, but pursuing a course here, it's better you pursue a course here and then you do your job there.
Okay. Yes, that might be issues because there are a lot of issues and disease and problems which are there in India, but they have never seen in US or Europe or abroad countries. So students learning education from there, they might not have any idea what is happening in India.
If you talk about US and UK, they are far behind in medical field as compared to India. India is called to be a third world country, but we are far ahead of them in terms of the medical field technology. Because I will share you an experience. We had a patient from US. He had cancer of the prostate. He had come for a therapy in our Fortis Institute. So on the first day he came, we did his blood test and everything. We did a gallium scan, which is known it's a whole body scan where the whole body is scanned for the metastasis, like where do you find the cancer in the body. So we did his gallium scan, and the next day we did his therapy. We gave him the therapy for the cancer for the therapy, and we made him meet to our medical oncologist and a urologist, and then we gave him the date for the next 3 months and everything. And all these things were done in 2 days. That patient from US said, ma'am, whatever you have done in 2 days, it would have taken us 6 months in US to get the scan. And the scan which we do here for about 25,000, around 30, 35,000 in India, it takes around 5,000 US dollars to be conducted in US, and that too in 6 months. So don't think that the studies are much better in abroad. I think the studies and the course curriculum is much better in India. The exposure is much better in India because we have so many patients. So we do have that type of exposure which we cannot have it anywhere else in the world. But once you pursue your course and you want to, okay, you are not getting a very good profile here and you have a opportunity outside, then I think you should work for the job outside. But pursuing the course here and getting the experience here and getting the exposure here is much better.
That's very clear, ma'am. So this would be, I think, a very clarified statement for the students and parents who are thinking for their student, especially for the medical degree abroad. So it is better if they are going abroad, it is to settle down there. Or if they have to come down India, they have to give a lot of examinations and entrances, then only their degree is recognized in India. That's great. Now, ma'am, we have talked a lot about this career. So, what are the 5 government institutions which would you suggest for paramedics as a course that students should target in India?
Foremost is AIMS, then PGI Chandigarh, then RML Lucknow, and even BRC, that is AERB in Mumbai. It is conducting some of the courses, but mostly in imaging technology. And then JIPMER is the government institute, and CMC Vellore. And finally, if you talk of the private ones, are the Manipal and the SGT University. And then there are very small institutes also like Bangalore Baptist Hospital Institute of Allied Sciences, even All India Institute of Allied Sciences in New Delhi. So there are plenty of them.
Okay. So students, I think ma'am has said it very clearly and she was very slow while she was said about the college name. So I think you have noted it down. If you have not noted it down, you can watch the video and you can get down to the colleges. So don't miss out this college's name because it is very important. So what we give you information is about internet research, and when directly the expert talk, it's about their experience. Ma'am, is there any scope for allied medical aspirants to work in defense? Because when we talk about medical, so defense is always a category which is taken considered in.
Actually, this armed forces keep on advertising their give advertisements for different posts in different branches because they themselves run their hospitals. So they need these paramedics and the allied health professionals for running out their different departments. So there is, I don't think they pursue a course there, but they have job opportunities.
So that means directly on the website of the college or with the advertisements, we can have the information about.
So, like it's DRDO in Delhi, which keeps on advertising their different posts for whatever they need. They need a MLT or a physiotherapist or a imaging technologist. They keep on advertising that. DRDO is basically for the armed forces, the hospitals which they run. So you keep finding those advertisements there.
Okay, so DRDO is the website where you can find it out, and related to the information, you can go to the mini career portals where you can get the information about allied medicals and paramedical courses. Whatever they are offering, it will be on the website. So students, keep this information noted. Ma'am, coming to the end, towards the end of the session, is internship a point of matter in paramedics as a course?
Yes, in some courses they provide internship, and I think internship is very important because by the time you pursue a degree, you are more focused on the theoretical part. But once it's internship, you have the practical exposure, and which I think is very important. Unless and until you have your hands-on experience, it's difficult to get into job directly and excelling into it.
So with the final question of the session today, what advice, suggestion, or mantra would you like to suggest to our young mass for this career as their future prospect and future option?
I think the persistence, the most important is the persistence and the passion. That once you get into it, you should not be half-minded, you should not be half-hearted, and you should think that I have got into it, I have to make best out of it. So that's the thing I would suggest.
So finally, there are two questions from students they are asking about.
Okay.
Ma'am, if I pursue the paramedics and allied medics courses in private medical college, do we have the scope to work in the same medical as an option?
Same medical, same institute.
That means the candidate is trying to say that I have, for example, let's take example of Indraprastha University. So I have done my BSc and MSc from Indraprastha University. Can I get a job in the same medical?
Yes. Actually, the students from the same universities or the same colleges are preferred because the faculty knows them, they have a reputation, they everything, so they know, they have a know-how. So it's always, and even the faculty wants to take their own students, so there is a high scope that you get the job at the same institute.
So beautiful question by one of the aspirants. My father says it is not a safe job for girls.
Safe job for what? In what field? I don't think physiotherapy is very good for girls. Imaging technology is very good for girls. Even then the dietetics is very good for girls. Then safe in terms of what? Ultrasonography is very good for girls. You obviously you will not have night duties either. You will not be having emergency duties. You can have, if you want, you can have a red collar job. So I don't think there is something unsafe in that. Unless and until you are doing even like I did my emergency duties and night duties in AIMS, so it was very, very safe. It's you know, you will never feel that it's night in an AIMS emergency department. It's always flooded with patients, with doctors, with nurses, and the paramedic staff and the DDAs and everything. You don't feel that it's night outside. So safety, I don't think it's an issue. Obviously, if you are not working at a very desolate place, then it may be. But again, it depends on what branch. Physiotherapy will not include any emergency duties. Dietetics will not include any emergencies or night duties or something like that. Optometry will not have that type of duty. So if you want to have a very safe and very red collar 9 to 5 type of job, then you can choose your branch that way.
So one last question. I like teaching and I want to be a professor in the future. So what course, ma'am, would you suggest me?
So then I think you should get into some theoretical branch like microbiology or pharmacy. Then you can have MSc anatomy and MSc physiology, where even after, without doing PhD, at the level of MSc only, you can pick up as a a teaching job. So
okay, one last question. I could have neglected, but it is a beautiful question. Ma'am, if I want to be a nuclear science and clinical research professional like you, so how many years I have to dedicate and what will be the salary I will be getting?
Actually, I did my everything with much breakups. So if you continue with things, I think in a time span of 10 years, you will be through with your PhD and all. And by the time you can have around 1.5 or 2 lakhs per annum. So per month. And then that's it.
Okay.
The most important thing is the branch you choose, where there is a scope. So if you go into pharmacy, if you get into an industry work, if you anatomy or physiology will have teaching jobs, then microbiology again will have a what do you say, teaching job. Then there is also one field called as biomedical engineering. It includes your job profiles in different industries or the companies like Siemens, Philips, etc., where they make machines for different types of doing different types of things in medical field. So biomedical engineering is also where you are involved in bio also, like medical field, and then the engineering part of it also. You can go for MSc Physics, MSc Medical Physics. So you'll have to find out and see what is your interest, and then accordingly, perfusion imaging is also good. So there are plenty of branches. It's not only the MBBS and end of the road. So you have to think of it.
Again, I was on the verge of ending this, but again, I don't know what happened to students today. They have got such a weird but very interesting questions. Again, there is a question that, ma'am, my brother says that medical professionals have no personal life. They have to dedicate their life to their patients and medical. So I think now, ma'am, it's the right time you can reveal how many places you have been to vacations abroad.
Has been around 14-15 countries for vacation I had been to, and especially for actually I did my vacations like I had been to a conference for presenting my work, and then I had covered 2-3 countries there, and so like that we have covered around 14-15 of the countries there. So it's not that you don't have life or your personal life, it's the balance you have to strike. Obviously, if you are a neurosurgeon, then you will think that you don't have a life of your own because an emergency can come at any time. You will have to do night duties, you will have to do emergency duties. But for allied sciences, I don't think it's not at all not at all like this, that you don't have time for the personal life, because you have a fixed you have a fixed span of work which you have to do, and you know what you have to do. And even if you have your own lab, if you have your own venture, if you have your own shop, then again it's the same thing. You'll have to strike a balance. Okay, I'll work from this time to this time, and this is the time which I have to devote it to my family or something. It's up to you.
Thank you so much, ma'am. I think the student got his answer right. And 15 countries, I think being a IT professional, that is very difficult for you to explore 15 countries in a 10 to 10 years of span. That is would be very difficult. Yes, 3 to 4 is okay, but in 15,
actually 20... as my husband is also a nuclear medicine physician, so we usually, like for last 2 years there had been no conferences, offline conferences, so we are struck. But before that we used to have a national conferences or international conferences. Just so to attend those conferences and to present in those conferences, suppose we had gone to one country, we will just take over we'll extend our vacation and have 2-3 countries more, and then we'll come back. So most of the time we did the same thing, even in India as well as abroad. So it's the way, and it's good to visit and attend such conferences. It gives you a good platform, and you come to know many new things. So it's the two-way, work as well as the vacation. It's a type of vacation. So
it's beautiful. Now, with that also, ma'am, you have made it very clear. One more thing, that if you are looking for the medical as a career, and as well as you want your personal life, and you want to give time to your family, then please follow madam. But try to find a partner who is into the same field as into the same.
That is more important.
That is more, because if you attend a conference also, you will be attending together. That's very great. Thank you very much, madam, for this beautiful session and for empowering our students about the allied medical and I again said allied medical, it is paramedics. So enlightening our student about paramedics as a career, it was altogether a beautiful sessions with some kind of spicy masala in it. So we had a lot of sessions today, but today the spice and masala was, I think, enough, and it was engraved in the session today. And beautiful enlightening session. The information that we received today was valuable, and point to point, it was noted. Being a counselor, I learned a lot of things today, which I'll keep in mind that I'll be guiding in the same way as you said in your answers today. Thank you so much, madam, for giving us your valuable time out of this. And you are serving our country, you are serving patients, you are doing a great job. And we will pray to God that they will always keep your blessing upon you in the field of medical. Thank you so much, ma'am.
Thank you. Same here, and thank you for being such a good host, as well as the students who had been attending this. Thank you, and I wish you all the best. And just get focused, and then read about it, think about it, and then pursue the things. Thank you.
Thank you, ma'am. CareerX signing off.